Repeated flexion and twisting of the elbow can cause micro tears to occur at the attachment site of the muscle tendon to the bone of the epicondyles of the humerus. Epicondylitis causes pain over the epicondyles, weakness of the wrist, and decreased grip strength. Reaching above your head and prolonged arm abduction can cause the muscle tendons to rub against the humeral head, causing irritation of the tendons and eventually tendonitis. Rotator cuff injury is an injury that is more common as we age. Add to that the stresses of our job, and this injury is becoming more prevalent. Rotator cuff injury can result when there's static posture that causes compression of the humeral head against the rotator cuff muscles. This occurs when the arm is elevated beyond 30 degrees. This type of elevation restricts the circulation to the humeral head and results in over 30 millimeters of mercury of pressure against the muscles and tendons and vessels in the shoulder. There are two types of muscle effort: static and dynamic. Static muscle effort causes blood vessels to be compressed while you're in a static posture. Remember, your muscles act as a pump for blood during dynamic efforts. The results of sustained static efforts cause insufficient blood flow to muscles and tendons and the ability of them to remove their waste products, which results in acute pain and muscle fatigue. Dynamic muscle effort allows for muscle contraction and relaxation and acts as a pump for blood. Blood-containing waste is pumped out of the muscles, and then during muscle relaxation, fresh blood flows in. Dynamic efforts can be sustained for much longer periods of time than static efforts before fatigue sets in. One type of risk-producing posture are those when you are at the extreme range for your extremity. This posture requires a lot of muscle activity to support your arm in this position. Awkward postures that are not at the extreme range can also cause injury. They can create a mechanical load on the body or the joint, and they change the body's alignment. Some possible effects when you're at your extreme range for your joint is stress on the joint, reduction or occlusion of blood flow, and high muscle force necessary to sustain that posture. An example of this is forearm pronation. As you see in this example, the sonographer's arm and wrist are pronated in order to perform this exam. When you change the body's alignment, the possible effects on the body include increasing stress on the tendons and muscles, and this causes injury to surrounding tendons. You obstruct normal function of the joint, and you can reduce blood flow. An example of this particular posture is wrist flexion. You will notice in this picture the sonographer scanning has a great deal of wrist flexion, reaching in to scan this patient. Wrist flexion reduces the carpal tunnel and increases pressure on the median nerve. Injury to the median nerve results in sensory and motor symptoms. When the wrist is flexed, the pressure against the median nerve can be 60 millimeters of mercury. When the wrist is extended, that pressure can be 120 millimeters of mercury. You will notice in these two pictures the wrist in flexion on the top and on the bottom. And in this picture, the extension of the wrist. Another awkward posture places physical loads on the body. The effects of this are that you increase the force caused by non-neutral postures, you increase muscle firing to maintain the position, and this causes a high risk for musculoskeletal disorder. One example of this particular posture is arm abduction. Unfortunately, arm abduction is a common posture in sonography, and you will notice in this picture the sonographer's arm is almost 90 degrees from her body. Not only is this sonographer's arm abducted, but it's actually behind her shoulder. You'll notice in this diagram the time it takes to reach muscle fatigue when you have different degrees of arm abduction. At 30 degrees of arm abduction, you can maintain that posture for about 60 minutes. But at 90 degrees of arm abduction, notice that you can only maintain that posture for about 10 minutes before muscle fatigue sets in. You will notice that there's a direct correlation between muscle strength and shoulder abduction. And as that angle of abduction increases, muscle strength falls off. Excessive reach is also an awkward posture that creates a load on the shoulder. It reduces your muscle endurance and causes fatigue and injury based on these times and these distances of reach. At 30 centimeters from your body, you can maintain that reach for about 30 minutes. But notice if it's 50 centimeters, it's only 7 minutes. Reducing reach can reduce muscle firing by up to 65% in the upper trapezius muscle. Notice the amount of reach in these two pictures. In this top picture, the sonographer's reach is actually with her non-scanning arm. So you also have to be aware of what you're doing when you're reaching for the control panel of the ultrasound system. In this bottom picture, the amount of reach is related to the sonographer reaching forward to access the patient. Increasing the horizontal distance of your reach decreases the time for the onset of fatigue. The work of your shoulder will increase as your hand moves farther from your body. This requires more muscle support and causes a quicker onset of muscle fatigue in your shoulder and arm. By supporting your arm with various different devices, muscle firing can be reduced. This will increase your endurance time even though you're actually reaching a little farther than 30 centimeters. Another posture to avoid is neck flexion and extension. In these three examples, the sonographers are in either hyperflexed positions or hyperextended positions. These positions are generally the result of where you position the monitor or yourself with regard to the ultrasound system. To prevent looking down, you should either raise the monitor or sit down. To prevent too much neck extension, you should either stand up or lower the monitor. Neck twist is another issue for sonographers. In this particular example, the sonographer is actually standing backwards to the ultrasound system, causing her to twist her neck almost to as far as it will go. This is another example of neck twist where the sonographer is actually trying to determine the lie of the fetus. Trunk twist is also an awkward posture in sonography. In this top image, the sonographer is reaching across and twisting her trunk to access the patient. In this bottom picture, the sonographer has set up the ultrasound system at the foot of the bed at 90 degrees from her, causing her to twist not only her neck, but her trunk. Another example of twisting, including bending to reach the patient. In this particular image on top, the sonographer could move the patient closer, which would prevent having to bend over. And in this bottom picture, the sonographer could move the patient closer and stand up straighter, stands closer to the ultrasound system, and prevent both twisting and bending. Other risks include excess force when we push against the patient or holding the transducer. Increased force is often required as a result of the increasing obesity in our population. Some of the other risk factors associated with obesity are diabetes, increased risk for heart disease, and decreased blood flow to muscles and joints. Therefore, obesity is not just a risk for us scanning, but it's also a risk to the worker's health. Obese workers have increased work limitations and decreased productivity. Obesity is actually defined as a body mass index of 30 or higher. We've seen an increase in this prevalence of obesity over the past 20 years. These next few slides will demonstrate the trend in obesity among United States adults. Starting in 1985, you'll notice that there's not much prevalence beyond 14%, and not many states that had that prevalence of obesity. But as we go through the slides, you can see that there's an increase in the incidence of obesity among all the states of the United States. 1995, there's a new category of 15 to 19% incidence. And when you get to 2000, you can see that there's a number of states where the incidence of obesity is greater than 20%. In 2004, there's a number of states where the incidence is greater than 25%. Other risk factors include gripping the transducer, whether it's too narrow or too wide. A narrow transducer causes a pinch grip, which causes the muscles in the hand and fingers to become fatigued. Too wide of a transducer requires too much stretch of the hand muscles. We have an increased risk for injury if we are gripping the transducer greater than 2 hours per day with either 10 pounds of force or pinching with greater than 4 pounds of force. Treatment for work-related musculoskeletal disorders is poor. Workers tend to return to the same risk factors that caused the injury to start with, and they become re-injured. Therefore, it's important to prevent these injuries. The keys to prevention are both ergonomics and education.